You're staring at your calendar and now you're wondering, is it just your period showing up early or could it actually be implantation bleeding? Because let's be honest, it can be really difficult to tell the difference when you're right in the middle of it. But today, I'm going to make this video super clear and simple so you can feel a lot less confused and a lot more confident about what's going on in your body. As a registered nurse and someone passionate about health, I just love sharing simple tips that can make a huge difference in your daily life and overall well-being. If you are new here, don't forget to hit the like and subscribe button so you can be part of this growing community. Let's just dive right into the video. Now, before we talk about the difference between the period bleeding and implantation bleeding, it is important for you to understand what implantation bleeding is about. Like, why are you really experiencing that bleeding? What is happening in your body? You see, during ovulation, the ovary release an egg, and this egg can only survive for 12 to 24 hours, after which it dies. Now, if this egg meets with the sperm during this time, fertilization will occur. After the egg has been fertilized in the fallopian tube, it is now called a zygote. Now, this zygote will now begin to travel down to the uterus, which is the womb. It finds a comfy spot in the uterus and attaches itself, and that process is called implantation. Now, you see, during the process, the zygote was trying to attach itself to the uterine lining. Some tiny blood vessels can break, which can now lead to spotting or little bleeding. This is now what is referred to as implantation bleeding. I believe we now know what implantation bleeding is and what happens to your body when you experience that bleeding. Now, the thing is, not every woman will experience implantation bleeding. In fact, most women don't experience it at all because it's possible for the zygote to attach itself without causing any disruption in the lining of the uterus, which is what actually causes the spotting or bleeding. And this doesn't mean your pregnancy wasn't well formed or indicate any issues with your pregnancy. It just differs for every woman. Now, let's talk about the difference between the implantation bleeding and the period bleeding. The first way you can differentiate the period from the implantation bleeding is through the timing of the bleeding. So imagine this, you just finished your last period a week or so ago, but now you're spotting again and you're wondering, is my cycle changing or could I be pregnant? But here is the thing, implantation bleeding usually happens about 6 to 12 days after ovulation, which is a few days earlier before your next period would start. Now, if your next period is a week away, but you're spotting lightly, there is a chance it could be implantation bleeding. Another thing to look out for is the flow of the bleeding. Is it light? Is it heavy? Implantation bleeding is usually very light, not heavy. It may just look like a few drops. Unlike your period, it cannot feel a pad or tampon. While your period, on the other hand, tends to start light but gets heavier. This is one way you can differentiate your period from implantation bleeding. Then the third one is the duration of the bleeding. Implantation bleeding usually lasts for a few hours, maybe 2 days max, and your period would usually last for 3 to 7 days. Now, another thing to look out for is the color and texture. Period is usually bright red or deep red, especially on day 2 or 3, while implantation bleeding is usually lighter, more like pink, light brown, or even rusty in color. And it's often not sticky or clotty like period blood. Then another thing to look out for is cramps. Now, you might feel cramps with both, but implantation cramps are usually milder. It doesn't last for long and less painful than the period cramps. It may just feel more like twinges or slight pulling. It's not as intense as the period cramps. You may also experience breast tenderness, mood changes, or even feel a bit off. Some women describe this as a weird feeling, almost like PMS, but gentler. Now, the big question is, how do you know for sure? Honestly, the only way to know for sure is to take a pregnancy test, but you have to wait till your period is due or a day or two after, so you'll be able to get an accurate result. If it's negative and you're still unsure, just give it a few more days and you take the test again. I hope this video clears a lot of confusion for you. Let me know in the comments if you have any questions about the early signs of pregnancy or any other question. Also, let me know in the comments. I am always here to help you out. If you found this video informative, please kindly like and subscribe if you haven't, and share this video to anyone you know might need the video. Always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching and see you in my next video. Bye.